Hi, and welcome to Hala City, a new podcast here in Dubai that's going to go behind the scenes of Mediclinic City Hospital with the aim of really empowering people in Dubai to be more proactive about their health and to learn and get answers to questions that they've always asked. My name's Shannon. I'll be the host for today. And over the next few weeks, we're going to be bringing in some amazing doctors. We're going to be delving into some interesting topics and introducing you to some people and incredible technology that exists here at City Hospital and help you to learn a little bit more about what goes on in behind one of the premier healthcare systems in Dubai. So today, to start the series, I'm joined by Mediclinic City Hospital's hospital director, David Eglington, and who's going to help us to sort of understand a little bit more about City as a whole. You know, what it does, where it's come from, why it exists, and really the motivation behind, why people come to work every day. So firstly, David, thanks. Nice to see you. How are you?
Welcome. Good. Thanks, Shannon.
I thought, to frame this, it'd be really great to know a little bit more about you. You're the hospital director here. Tell me a little bit more about yourself, where you're from, how you got into this, what drives you, what gets you up every morning.
So I've been a hospital director now for about 16 years. First in the UK, southeast of England, ran some private hospitals in England. And I guess over time, I learned a huge amount in the UK about the difference between the NHS and the private sector, which has prepared me hugely for Dubai, because actually it's kind of a merger of the two. It's both kind of, certainly at City, it's almost like a public sector, but with a private sector feeling in many respects. So I was in the UK for all of my career. And in 2013, my wife and two children and I decided to come to Dubai, fancied a new challenge. We had family here in Dubai who every year was saying, you need to come to Dubai, it's fab, you're going to love it. And we did, and we do. Dubai has been fantastic for us. I joined Mediclinic, so it was July 2013. First of all, started in Mediclinic Dubai Mall, and then we expanded quite significantly in a short space of time. We had a number of clinics as well. So I looked after Dubai Mall and the clinics. And then 2017 went back to the UK, kind of missed home. However, quickly regretted that. Missed working in Dubai, being in Dubai, and came back to Mediclinic. So I was working in Mediclinic 2013 to 2017, and then came back in 2020 during COVID. Very lucky to get back into Mediclinic. I worked for a Mediclinic organisation back in the UK as a hospital director, and then joined City in April last year, actually. And I'm proud to be at City. City's a wonderful institution and is the biggest hospital in Mediclinic Middle East.
Cool. So Dubai's home.
Yeah.
How old are your kids? Two kids?
15 and 13.
15
I
and
know
13.
I don't look old enough, but they're 15 and 13.
Well, you look great.
Yeah.
You look great. You definitely look old enough to have teenage children. I will say that. Hey, let me ask you. City Hospital, for many people, is like a fixture of the Dubai healthcare system. People think hospitals in Dubai, City is almost, it comes up almost like it's always been here. Tell me a little bit about its beginnings, when it started, how it's grown, a little bit more about it.
Mediclinic City Hospital was Mediclinic's first kind of new build, really, certainly in the Middle East. And it was built in October 20, or inaugurated actually in October 2008. So nearly 15 years now. It's always been the scale that you see now of the main building, City Hospital. So on our inpatient side, we've got 9 floors. On our outpatient side, 4 floors. Nothing's really changed the structure of that, but we have added the North Wing, which we're sitting in now, which is where the Comprehensive Cancer Centre is based. But it's 2008 it opened, and it opened then with about 30, 35, just under 40 doctors at the time. Now it's grown significantly in scale. We have just under 200 full-time doctors, plus a number of independent doctors, self-employed doctors. So that takes us probably to nearly 300 doctors overall. It gives you a sense of the scale of the hospital in terms of our service offering. And I think very quickly, Mediclinic was a trusted international brand. It wasn't necessarily a brand that was super well known in Dubai, but has always been ethical. It's been a publicly listed company, and as a result, we have really high levels of corporate governance, and as a result, clinical governance. And I think that struck a chord in the market. Also offered choice. There were much fewer private providers than there are now. And over time, we've grown to a scale now. We have tried and continue to differentiate ourselves in what is becoming quite a crowded market now. So we're proud of the legacy, but also what matters most is where we are now and where we're going moving forward.
I remember when we were talking before, some of the statistics that really stood out to me, and I'd love to get your thoughts on this. Since it's been open, 40 adult patients have received a kidney transplant. I mean, it's life-changing. And 55,000 roughly babies born. I almost did a double check on that. 55,000 babies. I mean, I think of the extension of how that changes people's lives. I mean, it's incredible. I'd love to, hear what you think about that.
Yeah, I think it's kind of mind blowing when you look at the stats. So every now and then when we do anything linked to the press or when we have to do things like annual reports and accounts and things like that, the things that we see every day and we almost take for granted, and get lost in the noise of doing a job, actually you forget some of the things that we do. When I heard 55,000 babies, I was also surprised and delighted.
Two's enough.
Yeah. Yeah. And I guess, again, it just goes back to the legacy of City Hospital. I've always felt you work in healthcare, you feel responsible, particularly if you worked in healthcare for a long time. And for me, City is a huge responsibility because of things like 55,000 babies. The other day, my daughter was talking to somebody, and it turns out that she was born in City Hospital.
Wow.
My daughter's 13 now, so we go back sort of, I guess the oldest baby would be nearly 15 now.
Amazing.
Because there was a baby born in 2008, so we're pretty close to nearly 15. I know that people talk about, triplets. It used to be huge news, and it's not so much. But again, it's still such a significant thing to be able to do, and when you also think about things like that's someone's family, they're starting. It could be their first child. It could be the wanted child, the child that has been desperately needed really for the family. So it's such an emotional thing when you think about it. So you kind of, the stats surprise you, and then you kind of delve into the stats and you think, oh my God, that's amazing. 55,000 babies. And the transplant really actually has really started to gain momentum. We did our first transplant in 2016. And actually for a while we were just doing the odd one or two. And for a whole host of reasons, a whole host of sensitivities, complex reasons. But fundamentally, we're starting to see more and more of that now. We're starting to see more transplants. So last year, we had a much larger number than we've had in the past. More and more people have trust in the UAE healthcare system, helped by, I think, Mediclinic has played its part in that. So people don't travel so much for healthcare. But also, we're attracting doctors from around the world that are genuinely top of their game, are genuinely world class. Our transplant surgeon, he's working with the Dubai government and ourselves. He works in Al Jalila as well. But he previously worked in transplants in Stanford University. He was the head of the transplant program at Stanford University. So these are genuinely world class clinicians, and we're lucky to have them in Dubai. I guess that's because Dubai now is such an attractive place to be that people actually want to come here.
Yeah, for sure.
And stay here as well.
You mentioned about trust. Which is probably the most important thing in healthcare. And one of the things, for me being from Australia, you're from the UK also, often you think of the most trusted healthcare facilities are generally those big teaching hospitals. Those hospitals that are affiliated with a university get medical students through those big tertiary groups. One thing I didn't know is that City Hospital is a tertiary hospital. I wasn't aware of that. I'm sure a lot of people aren't aware of that. Tell me more about that. I'd love to know a little bit more about how that works, the students, what's the process here?
Actually, it's just what we do is we have medical students, and many of our doctors are teachers, medical teachers. They're adjunct or working at Mohammed bin Rashid University. And it kind of just happens. We've got such a big number of people involved in that process. But actually, we are a genuine teaching hospital. I mean, I Googled the definition of a teaching hospital because I'm conscious of saying things, particularly in healthcare where trust is so important, of saying things that aren't true. And by definition, we are a teaching hospital. We're affiliated to a university, a medical school, which is MBRU in this case. We also work with some other universities, but we have had an affiliation agreement with MBRU since 2016. And we have many of our doctors working at MBRU teaching the doctors of tomorrow. I agree with you. Teaching hospitals, certainly in the UK, are usually perceived to be perhaps there's higher standards of clinical care, and that's a sweeping generalisation and clearly doesn't count in every case. But I think the reason is when I speak to doctors and when we recruit doctors now, many of them talk about they want to teach, in part because they want to give back. But when you talk to the doctors and say, well, what do you like about it? It's just fun. You're teaching students who are interested, and it kind of keeps you young. But actually, it's the fact they like to be challenged and they're held accountable, because a student will ask, well, why did you do that? Or Why did you ask that patient that? Or why did you come up with that treatment plan? And the doctor then has to think. So it's not automated, because there'll be many specialties where the doctors see, I don't know, 10, 15 patients a day, and it's the same kind of issue. If you think about when schools come back, and children get picked up some viruses, some coughs, colds, and things like that, many of the patients they see in paediatrics will be of the similar kind of vein. Having a student there who wants to learn will ask you questions. You're being challenged. You're being held to account. And I think that's probably what keeps those teaching hospitals at the top of their game is that accountability, a responsibility not only to patients actually, but also to the students. And the fact that you want to, most people, certainly in healthcare, people come into healthcare because they want to look after people, or they want to care. And I think that it can get lost by taking things for granted. But I still think fundamentally, people are in healthcare for good reasons, and this is a reminder when you're teaching a student, you're teaching them with the best of intentions because you want to do right for that individual, and then they'll go on and pass that on. They'll pass it forward. So I think it does. I think it does make a difference, and I've worked in non-teaching hospitals, and I believe it does make a difference.
I totally agree. Let me switch gears a little bit to talk about patient care. I'd like to, because I think for me, I think for most of us, going to the hospital is something we just don't want to do. We both work in the healthcare industry in facilities where people would rather not come to see us, right? And one of the challenging things about being a patient in a hospital is not only are you unwell at that particular time if you're a sick patient, but you're trying to navigate your way around a complicated system. It's not just one area. It's you're navigating. It might just be both physical, it might be psychological, it might be nutritional, and you might be through multiple subspecialties, which for patients, that can be very challenging, right? You mentioned about City's integrated care models. I think a lot of people might not know what that means. I'd love if you could share a little bit more about that, what that looks like.
Integrated care models, there's probably a really good technical answer for what an integrated care model is and how we apply it. And maybe one of our doctors who does the teaching at MBIU could help us. But the way I see integrated care models is if you're a patient and you are going through a journey, and let's take perhaps one of the more tricky areas. If you've been diagnosed with cancer, which is probably the most difficult thing that someone has to come to terms with. Historically in healthcare, you've kind of jumped from doctor to doctor. And the reality is you don't always need treatment. Sometimes you need to be looked after in a different way. So in the UK, which has done a lot of work, particularly around cancer services, you have Macmillan nurses, for example. So that means that the doctor's providing you with the clinical information, which, let's face it, you've just had a bad news consultation, and you'll miss most of that consultation. There's a lot of evidence to show that you should be recording those consultations, so actually the patient and then their family can hear the details of what to expect. From there, you will often then see a nurse or a Macmillan nurse, someone who's trained in providing information such as, and it's not about the type of chemotherapy drug that you might receive. It's more about the impact it will have on your nails or your hair, or what does it mean for me financially? Will my employer, does my insurance cover it? Those kind of things are actually much more important to the patient, or needed and valuable at that time. So integrated care models, yes, there's lots of technical answers, but my interpretation of an integrated care model is making sure that it's not just patients bouncing from one person to another, is that actually it's joined up. And we had an example recently. One of our patients sadly has been diagnosed with breast cancer, and during her journey with us, she's not been with a patient for too long, her son's been diagnosed with leukemia. And from there and from the support, in isolation they would have seen different doctors, but actually the patient came to an event and has met with one of our psychologists. And as a result of that, the son is now seeing the psychologist as well, because it came up in the discussions, because it wasn't actually then, it's not about her, it's about her son. And from that, I guess from that point, that is integrated care. There was elements to it, but also what's then happened is her son is now setting up a teen support group. So that will be the first in the UAE, because actually the incidence, thankfully, of teen cancer is very low.
Yeah.
But actually, he's now with our psychologist. He's going to set up a teen support group, and so actually that's going to benefit more people.
Yeah.
So it's almost like enabling patients to kind of to be involved in their journey, and we tailor the services around what patients want. We're not there yet, but I think the reason why I talk about cancer services is that's probably one of the most powerful areas of where patients need that support, but they don't want to. We can't fall through the cracks.
Let me ask you, you just touched on something I'd like to delve a little bit more into about this family, this mother and daughter is I mean, such a sad, like, as a dad myself, this is like your worst nightmare. And I hope that they recover well. You talked about the support groups.
Yeah.
And one of the things that I've noticed is that often those areas, whether that be at-home support, social workers, psychological support, even lifestyle interventions, are often the things that can be neglected. Is that something that you're seeing City Hospital moving a little bit more towards, in terms of having not just an integrated patient-centric model like you described, but even more of a holistic model, like looking at things like support groups and nutrition and at-home support? Is that something that you're moving more towards?
Yeah, absolutely. I think it's an area of improvement that's required, both I think in the market in general, and it's through no one's fault. But not long ago, when I was here in 2013, many people for complex care they travelled, they left the UAE. And I think that the role that providers such as Mediclinic has done in creating trust in the healthcare system, the links with MBRUs enable us to recruit top doctors from their home countries, and then that in itself has developed further trust, which meant more people have stayed, which meant that there's more people to utilise the services, keep doctors skilled, because actually that's a key component, is that if you've got a subspecialty expert, they have to see a certain number of patients to stay skilled.
Yeah.
So actually that's become really important. And then by doing that, you retain those doctors and so on. It's almost self-fulfilling. By doing that, you then start to add in services, and then you start to look at it in a much more holistic way. So before, it's perhaps growth has come from you've got a consulting room, you put a doctor in the consulting room, patients will come or not. Over time, that's now evolving. So you start saying, actually, well, what is the need? So the consultants will say to us, actually, we really need a psychologist for the cancer centre. We really need a dedicated physio for the cancer centre. We have to have a dedicated dietitian, because actually these things are different. They're different to the mainstream or to the general or to someone looking at weight loss, for example. This is a different expertise. And the more patients that we see, the more we're able to retain those individuals. And then from within that, those doctors, it's one of my favourite books. My old boss gave me a book, Jim Collins' Good to Great.
It's a great book. I know the book. I know it. Yes.
Yeah, I sound like such a geek now, but
No.
in there he talks about, you put the right people on the bus and they'll drive the bus.
Absolutely,
They'll take the direction, and that's what we've tried to do here at City. It's minimal intervention in many respects. There's a framework, there's governance, obviously, but the important thing is you recruit the right people. They'll start developing those services, because I'm not a doctor, but even if I was a doctor, I'd be a doctor in one field. What you need is a team of people, a group of people who are all aligned behind ultimately what's best for the patient. And I believe at City we've been able to recruit doctors who are aligned behind that view.
I mean, I totally agree with you, and particularly when you talk about the scale of City and you talk about thousands of people coming through the door, but for that one patient, that one mother with that one child, that's everything for them. They have to navigate work and home and other children and all these responsibilities. If you can take some of that mess away from the patient, boy, that just makes such a big difference. One of the most fascinating areas of a hospital, and probably as fathers, one of the most terrifying parts of a hospital, is the neonatal intensive care units, the NICUs. Hopefully it's a place that most people don't get to see, because those children are in an extremely fragile state. But you have an amazing NICU, incredible. I'd love to know a little bit about that, just in terms of, how young are the kids the babies that come in there, and the work that those doctors and nurses do in there is inspirational. I'd love to know a little bit more about it.
Yeah, I think as a dad, see, I wasn't a particularly emotional person when I was when I was
I am
yeah,
an emotional
I don't know, in my 20s. I had children. I suddenly cried at everything. Reality TV, I cry at. I know it's coming as well.
Yeah.
And working in healthcare I hear stories. I see patients. I met patients, and you kind of. Some of it's heartbreaking, I guess, but in NICU, actually, sometimes I struggle to go in, if I'm honest, because
of course, yeah.
it's like it's incredible the work that's undertaken, but when I do go in, I kind of almost feel completely uplifted, but then I suddenly check myself and then think, oh my God, how young. I think our youngest baby that we've had is 22 weeks.
Wow.
Weighed about 450 grams, and I can't relate to that, but smaller than my hand is. And the nurses in there, the consultants, the doctors that work in NICU are incredibly dedicated. They are, as I are in every department. Sometimes I do find it quite emotional going into the department, but the team there are fantastic. And I went in not long ago, and one of the babies I think she was 26 weeks, and she'd pulled out to the cannula and knocked it out, and she was crying, and I was, oh my God, please, someone help. And then the nurse came in, quickly realized problem, and then had to insert another needle into a 26-week old baby, and I was blown away. She was so calm, and the baby instantly just kind of stopped the stress and the anxiety and the crying. It was incredible, actually. It was, in that moment, you realize just how precious those skills are, that experience of that nurse, and they do it every day as well.
Yeah, it's amazing. I have the utmost respect for the nurses there, the doctors and the nurses. I was talking to one of the nurse managers in the NICU, and I was asking her about this, and because obviously the kids can't communicate and they're wired up to all these monitors. I said, how do you observe it? She's like, well, we observe them, of course, and we observe the monitors. But she said this thing that stuck with me. She's like, but we feel them, and we feel how they're feeling. And she related that like over 90% of the nurses in the NICU are female, or mothers. And I was like, that really touched me. I was like, that's just amazing.
Yeah.
They are there for the right reasons, which is incredible.
Yeah.
Let me ask you one more question on this piece. For me, I notice about every time I come into City Hospital, either as a patient or with one of my family members, and in Mediclinic, is this attention and focus on doing the right thing. And that's really about the patients. It's always about the patients. You were telling me about a story. I would love it if you don't mind sharing it. About doing the right thing, about how yourself and the team at City really went above and beyond in a very unique circumstance. I'd love to share that, because to me that epitomized the people, the heart and soul of the medical staff that work here. I'd love it if you could share that.
We had a particular patient, the one that I described to you. We had a patient who unfortunately had been diagnosed with cancer. She'd had some treatment. She was on chemotherapy, but had a really unique reaction to the chemotherapy drug. Her body responded, almost overwhelmed her body, and was in our ICU. And the only treatment, because it was such a unique reaction, and clearly we do many tests on patients to see that they can tolerate the right chemotherapy, but this was a very unique, and I can't remember the stats, but it was something like 1 in 100,000, one in a huge number. It shouldn't have happened, but the patient had this allergic reaction, and there was the doctor quickly identified that there was one, and actually it was largely because the doctor also had got some experience working in research in the pharmaceutical sector, identified that there was one medication that could potentially save the patient's life, but it was only available in Europe. And the patient, there was a window of, I think it was about 48 hours, which to administer this medication. It was the only thing that was potentially going to save the patient's life. The drug, because it's so unique, was very, very expensive, much more expensive than you would expect many of the medications that we deal with on a day-to-day basis, and it had to be imported. The team very quickly, straight away, got on and spoke to the various authorities about importing that medication, because there's strict rules, rightly so, about importing medication, and particularly something as powerful and unique as this particular medication. They quickly got onto that. They got the approvals from the authorities. The authorities were very, very helpful and amenable. They understood the story, realised the urgency of the matter, and they approved that. Then we spoke to the insurance company to get approval to administer the treatment. And the insurance company, this was new for them. They hadn't come across this. In fact, nobody had come across this before. And so there was a slight delay in approval. So we had to decide, do we to continue? We import the medication, administer it at completely our cost, or wait and risk the patient not making a recovery. In the end, it was, and to be honest, it was quite an easy decision. The decision was, let's get on with it.
Yeah.
Now, ultimately, in the fullness of time, the insurance wasn't an issue. As we said, the medication had been imported and there were no issues there, and the patient made a recovery. But it was a straightforward decision, because our culture is to do the right thing.
Yeah.
In an emergency situation, you can't help but think that could be my wife, that could be my son, my daughter. In healthcare, you fundamentally have to do the right thing. There are complications, there are challenges to that. There's regulations that we have to abide by, but ultimately, intrinsically, when it comes to it, the team were all aligned behind doing the right thing.
Yeah.
It could have been too much hassle. And everyone would have understood, actually. I mean, that would have been difficult to proceed so quickly and so promptly. It was a 1 in several 100,000% chance of something like that happening. But fundamentally, everyone aligned and got on with it and did it, because I believe when it comes to the crunch, when it really matters, is that people imagine that that's themselves or someone in their family as well.
Well, absolutely. I mean, and you think about it. I mean, I think about that, and I know your dad, as you mentioned, and that's what you think about. It's like, man, that from a large institution, that's what you want.
Yeah.
You want people just to do the right thing. David, thanks so much for talking.
My pleasure.
I've loved it.
And I did talk, didn't I?
No, I loved it. I would love to speak longer. We have to have round 2 of the conversation, but thank you. It's, you've got an amazing team, and as a husband and a father in Dubai, it's just reassuring to have a place like this. So thanks so much, man. It's great to be able to talk. And for everyone listening, I hope you enjoyed the discussion, listening to David and I, and it's going to be something we're going to do regularly. We're looking forward to welcoming a number of people back here to talk about a lot of interesting topics. So we hope you can join again. In the interim, stay healthy, stay happy, and we'll see everyone next time. Thanks. Bye.